South Korea's President Moon Jae-in is facing growing public pressure over his COVID-19 vaccine plans. The criticism comes as the country reports another 1,092 new infections. That's the second highest daily tally. The government's vaccine procurement approach has been labelled as too relaxed, with an over-reliance on locally produced inoculations. Critics say that overseas vaccine alternatives could be rolled out faster. Now, a local poll has found 60% of South Koreans believe that vaccinations should begin as soon as possible. Mr. Moon, though, has assured the country that its vaccination drive will not begin too late, with the campaign due to start in February. Now, at the same time, new restrictions are in effect in Seoul and the surrounding areas. Gatherings of 5 people or more are banned until January the 3rd. Lim Yun-suk has more.
All public spaces in the Greater Seoul region will come under the new restriction on group gatherings. And starting Thursday, the tighter rule will be extended to cover all restaurants across the country. Also from Thursday, more than a dozen ski resorts across the country will close, together with other winter tourist sites. Hotels and guest houses can only operate at 50% of capacity. Despite the spike in numbers, the South Korean government is still reluctant to impose level 3 restrictions, saying that would have a very bad impact on the Korean economy. Under the government's guideline, level 3 should be adopted when local infections total between 800 and 1,000 a day, or the daily tally doubles from the previous day.
사실은 그게 방역 면에 봐서 그렇게까지 갈 필요는 없지 않냐. 아직 우리나라는 한 1,000명 수준인데 인구 비례를 봤을 때 그 다른 선진국과 비교해서 훨씬 낮은 비율이기 때문에
3단계 되면 더 지금 아예 초장에 3단계를 먼저 하고 그런 다음 어느 정도 괜찮아졌을 때 내려가는 식으로 했었으면 더 어땠을까 이런 생각도 해요.
지금 계속 얘기를 하고 있기는 한데 아마 어려울 것 같아요. 가족들이랑 모임하고 그런 게.
Meanwhile, the government says military hospitals are being used to treat COVID-19 patients. Some university hospitals will also designate a certain number of beds for COVID-19 patients, while some college dorms are being used as treatment centers too. And efforts are being made to try and lower the number of patients who have to wait for more than one day to be admitted to hospitals.
오늘 0시 기준 수도권 1일 이상 병상 대기자는 183명이며 500여 명 이상까지 늘어났던 대기자가 대폭 줄어들었습니다. 1일 이상 대기하는 경우를 2자릿수 이내로 유지한다는 목표하에 병상을 더욱 확충하고 배정을 신속하게 처리하도록.
Still, it's expected that things will get worse before they get better. The head of Korea CDC, Chung Eun-kyung, has warned that the number of daily new cases could go as high as 1,200 in the coming week after the Christmas holidays. Lim Yun-suk, CNA, Seoul.